I'm Deb Elder, and I'm the Executive Director of the Flippin Lyme Foundation. We teach apitherapy or bee venom therapy to sick and chronically ill patients all over the world. The Flippin Lyme Foundation is a 501c3 federally recognized nonprofit agency, and we are educators in Lyme disease pathogens, and we try to reach out to people like chronic pain patients, arthritis, fibromyalgia, Parkinson's, MS, and other chronic illnesses. I found out after more than 30 years of suffering with chronic pain and fibromyalgia and intractable symptoms of all array that I have actually Lyme disease. Lyme disease is a series of bacterial infections that come with some additional co-infections and what are called shed fungal agents. And Lyme disease is a very difficult illness to treat, and there's a lot of controversy about types of treatment and opportunities to treat. Without any options for treatment in Oregon, what I elected to go with was to sting myself with honeybees, because the venom kills all of the pathogens in me, and it helps to break up the biofilms, which is kind of a slime coating on the outside of these little pathogen colonies, and that helps to collapse those down, and essentially biofilms are what are the causation of a chronic illness. The neat thing about bee venom is it kind of doesn't matter what you're infected with. The chemical agents will kill all the pathogens, whether it's bacteria, virus, or parasites. And so bee venom is just a superpower in treating all of those agents. Bees are in decline, and largely that's due to pesticides and other chemical components in the environment. However, the bees that we use for apitherapy are raised for medical purposes, and then they're mailed to patients throughout the United States. We also encourage patients that are going to be long-term users to grow their own bees in their hive in their backyard. And so that way they're growing their own medicine. But we don't take bees out of the natural environment. We're not depleting the bees that are in the environment today. But it's important to note that bees live a short life of 6 weeks. So the fact that we can use these bees and let them give us a gift of health at the end of their life, I think is a really neat gesture. The outcome of patients who do primarily antibiotic treatment is not really good. So I was looking for something that was highly effective and low cost, and that's available to me here in Oregon, and bee venom is the top of that list. I mean, I haven't found anything else in the world that's more effective at treating Lyme than bee venom is.